And the outcome was fantastic. And the reason that case is so memorable is that she came in and really had become, I guess, kind of almost embarrassed in her look.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Rick Myers of Functional Wellness and Aesthetics. Rick graduated from Oregon Health and Sciences University in 1994 and has spoken at national conferences in the United States and Canada on several topics, including pain management, mind-body medicine, and the management of chronic illness, and was the primary investigator in two publicly funded research studies, one on non-pharmacological approaches to chronic pain management, and one on the use of GLP-1 medication for the treatment of alcohol use disorder. In 2019, he founded Functional Wellness and Aesthetics, a medical practice founded on lifestyle approaches to weight management, aging, and physiological wellness, along with providing aesthetic interventions to improve health and vitality. So Rick, welcome and glad to have you here.
Thank you very much.
Yes, let's dive right into it. How did you first get interested in medicine?
I loved science and I kind of tripped and fell into it. I'm a nurse practitioner. And so at the time when I went to school, there was a great demand for nursing, and it was the great intersection between liking science and having great job prospects when I got out of school. So I kind of tripped and fell into it, and since then have been kind of building and specializing in various aspects, and that took me to where I am today.
Got it. So it sounded like you kind of start off more in pain management, that mind-body medicine, chronic illness, things like that. So how did you make that transition to include aesthetics as well?
Well, what I found is that as I started working with more chronic illnesses, that included things like ultrasound-guided injections, treatments for chronic pain that really had a technical side to them and required specialty training and kind of an artistic flow to be able to do a good job at it. So to be honest, I went to a conference where I was being taught how to be certified in ultrasound-guided deep joint injections. And on one of the tracks, there was the opportunity to learn more about doing aesthetic injections. And so I took advantage of that track, and it was something that kind of came naturally to me. And so I incorporated it into my practice. And since then, it's become a bigger part of my practice and something that I enjoy doing and that I've become very good at. And it does take practice and skill and experience. And so it kind of is nice to be able to look at a person from an aesthetic standpoint, and then also look at them a little bit deeper from the medical or metabolic standpoint, to be able to say to a person, okay, here's what we can do with this treatment, but there are some things that you can do from a health perspective that will potentially even be more effective than putting filler in or putting Botox in, which can be very helpful. But if you have a person who is not healthy in other ways, for example, they're a smoker, or they're using too much alcohol, or their diet is horrible, or they have massive sun exposure, then things we do from an aesthetic standpoint aren't really getting at the core of what is troubling them, which is most often age and kind of ways that they've not cared for their body. And sometimes if you can address those things, then the aesthetic treatments that you do, and that most of the time are temporary in the aesthetic field, are either enhanced or unnecessary.
So you're looking at it more from the holistic viewpoint, kind of making sure everything in the body is working well together, so that when you do look at the aesthetic side, you're not kind of having your body fight against itself.
Yeah. And, we see people who have come in and maybe they're 45 years old, but they are doing a lot of things to not maintain their health. And then we'll see somebody who's 65 and they are having a lot of effort paid towards maintaining their overall wellness. And the differences sometimes aren't that big. I read an article yesterday that said only about 30% of aging was attributable to how old you are in years. The other 70% is attributable to lifestyle factors. And so ignoring the 70% is really done foolishly by a lot of people who want to look and feel their best.
Got it. Now, in your introduction, we talked there was the GLP-1 for alcohol use disorder, which I think is fascinating. I've never heard of GLP-1 for alcohol use disorder. I mean, I think most people think about it for weight loss. So could you talk a little bit more about that?
Well, it's kind of something I tripped and fell across, and that was that when I started prescribing GLP-1s to many patients, I started having people say, this is weird, but I just stopped drinking. And, I woke up the other day and my drink was still on the counter and I felt that odd. So, I heard it enough times to where I did what a lot of patients do and go to the repository of information called Reddit. And just searched the GLP-1 threads for any mention of alcohol and its impact how it was impacted by GLP-1s. And I ran across this many, many times that people would report that effect, that their alcohol cravings or their alcohol use would go down greatly. So I happened treating a patient who was heavily involved in one of the local detox centers. And I said, hey, if you're looking at people who are trying to quit drinking, you should look at some of the information, some of the data on its use for alcohol use disorder. And if you look back over the history of GLP-1 research, this interaction between alcohol use and GLP-1s is not new. It was noticed in early animal studies that rats that were made to be alcohol dependent and given GLP-1s many times tapered themselves off of alcohol, which was unheard of. And I invite anybody who's watching this just to do a Google search on GLP-1 or semaglutide and alcohol. And you'll find that there are many studies and even more reports of people saying, my cravings for alcohol just went away. So, like I said, I was treating somebody for aesthetics who worked at a local detox and said, you ought to look at this. A couple of months later, I got a call from them saying, would you like to be involved in a study? We're interested in doing that. So I was engaged in that study. That study is not published yet, but the take-home message is that relapse rate from detox in this setting was about 85%. Treatment as normal, meaning people who just went into detox and then left detox relapsed about 85% of the time. In our study group, that number was reduced to about 15%.
Wow.
So tremendous impact. And I have had patients on GLP-1s who overuse alcohol as part of their lifestyle, and they've actually come off of GLP-1s because not having the craving for alcohol was frankly uncomfortable for them. It was part of their lifestyle that they wanted to maintain, and GLP-1s were interrupting that. So it was sad that some patients chose to take that tack, but it is massively important. And not only for alcohol use disorders, but if you look at GLP-1s or semaglutide specifically and its impact to many compulsive behaviors, there's a significant impact. So things like shopping, gambling, of course, eating is very important, compulsive eating, and that is a big impact or a big predictor of who is going to succeed greatly on GLP-1s is how it affects their compulsive eating. And for many people, it's massive. Interesting.
Wow, that's really interesting. Now, Rick, I know that your practice offers a lot of different services, but I want to dive a little deeper down into the GLP-1 since that's the one that I think you really have a lot of the knowledge in that's unique from a lot of other people. And I think with a lot of people looking at GLP-1, it seems like it's gotten really, really popular in the last 2 years. So when GLP providers are out there and there's the option between actually going to see someone and just doing a phone order and just ordering and just getting it shipped to you, What would you say is the biggest differences between those two scenarios? Like, should someone go in and actually talk to a provider and do it that way, or should they just go online, have it shipped to them, and they do it themselves?
That's a great question. So I think there's multiple reasons why doing it over telemedicine and I have some patients who have reported that they know people who are even directly purchasing it from labs in Asia or Southeast Asia or Mexico. I think one of the big differences is safety. There was a recent study done, I believe it was out of San Francisco, where they got GLP-1s direct from manufacturer compounding labs out of the country, and 2 of the 10 actually had the GLP-1 in the correct dose. So 80% of them were either not present or the dose was inaccurate. And I think we have to keep in mind that these massive factories that create these peptides are not just producing that peptide, they're producing who knows what else. But I think that at some point, when enough people do that, there's going to be significant problems with contamination, and that raises real safety risks. Another big difference between seeing somebody in person and getting it through the mail is that people have multiple reasons why they need to lose weight. It isn't one. And so there are some people for whom one of the GLP-1s may work better than another because of the reasons. As I mentioned earlier, compulsive eating tends to be much more directly impacted by semaglutide versus tirzepatide, for example. When I see people, we're talking about their diet and their activity level and their side effects, all of which cannot be addressed on a one-page form that you fill out and send in. So we do a lot of coaching, and it's really a joint venture between me and the patient, teamwork to reach a goal. There are also some people for whom the very strict criteria around GLP-1s, which is a BMI of 27 with a comorbidity, or a BMI of 30 without a comorbidity, would easily make them, if they don't meet those criteria, they would otherwise be ineligible to get a GLP-1. One of the things that I do is dig down deeper and say, okay, this person has a BMI of 26, but what is their body composition? What is their waist to height ratio look like from a measurement standpoint? So there are people who have a BMI of 30 for whom GLP-1s would not be appropriate. For example, I always remember that Arnold Schwarzenegger at his prime would have been considered morbidly obese. He would not be a candidate for GLP-1s, though. Yeah. And I have visited people who have what would be considered a normal BMI, but who are over fat and very unhealthy. And so, that kind of massaging of who is actually appropriate can only take place when you get to know a person's overall health. And there's another factor too, and that is that these medications are for many people a lifesaver, and they are a miracle drug, but they are not perfect. And management of side effects is something that is primarily done through behavior management, but also requires medical interventions at times, whether it's adjusting the medication, switching to a different medication, or managing the side effects through addition of short-term treatments. And those are things that typically are not offered as part of a non-in-person GLP-1 treatment protocol.
So if someone is looking on their own, they're probably not getting, I guess, even like the dose right, the type of treatment that they need. So they're just really, I guess, rolling the dice if they try and just get it on their own without seeing a professional.
I think that's true. And even professionals sometimes don't get it right. I have seen several patients who are prescribed a GLP-1 by their primary care provider, and they just come to me and say it doesn't work. And I look at their dosing and what medication they're on and the advice that they've been given as far as how to use it, and it's all wrong. And it's not a surprise that it doesn't work. I saw a patient recently who was on this medication for 3 months, and she had lost a total of 4 or 5 pounds, not anything that we would expect. And when we reviewed the dose, it was because her primary care provider had started her on the very small introductory dose and never advanced it. There are some people who are going to fit right in the middle as far as the dose they need, how their side effects are, whatever. And there are a group of people who everything goes exactly as expected. But as many people as there are as many responses to this medication. And so having somebody who has good experience and not only understands the medication, but the dosing schedule, the side effects, the precautions, all of those things is really important. I recognize that these medications are expensive. And sometimes people will say, well, I'm saving $20 or $30 by getting it online. But if it isn't effective, then you might as well have not taken it. And so having somebody come in and really be becoming a partner with them to say, okay, here's your goals. Here's what I think we can do as far as reaching those goals, and then being there to kind of pick them up, support them, be there as an ongoing resource is a really important strategy.
Got it. Now, for people who are looking for help with this, kind of as you mentioned, you want to find like really the good professionals. What advice would you give to someone on how they can start looking around for that right professional, that right provider?
Well, I think you need to interview their provider a little bit and ask them questions like, how many times have you prescribed this? What do you do if side effects happen? Even a question such as, how does this medication work? And what is the percentage of people who will experience a side effect? Any provider should be able to give you detailed information on how the medication works and what are the side effects. And if you are working with somebody who does not know the answers to those questions and knows them in depth, then my recommendation is find somebody else who does know the answers to those questions, because the answers are really important. And as I mentioned, they are expensive. And so if you are paying money for an expensive treatment, you want to make sure that the person who provides it is well-versed in what it's doing. Another thing I would say is make sure that any provider that you are going to be going to can show you in writing the medication and its provenance, meaning an inspection bill from the lab that it comes from, expiration dates. A good example on expiration dates is there are clinics that will send out a bottle of this medicine and it is supposed to be used for 3 months. Well, that is strictly speaking not even legal. Once a bottle is pierced with a needle to draw the medication out, a 30-day window begins to open. And at the end of those 30 days, that drug is no longer considered sterile. And we have to keep in mind, this is an injectable drug. And so we're bypassing all the safety measures that happen in our mouth and our gut when we take a Tylenol that's been expired for a couple months or sometimes a couple years. We don't have that safety margin. And so having somebody who just really is experienced in it and is going to be your partner and has a lot of knowledge is something that I would recommend. Whether it's me or somebody else, they should understand metabolic medicine and understand how this drug is making a difference. And if not, then they should continue to look for somebody who does.
Great advice. Now, I've heard different things about GLP-1s. I've heard that for some people, they have that the Ozempic face where their face kind of shrinks in or looks shrunken. And then there's also, I've heard things about like GLP-1s really lower your muscle mass, which is also not good for you. So in what situations would you want to use a GLP-1? And if you are taking it, how are you able to mitigate some of these other issues that come along with it?
Well, the strict contraindications to GLP-1 use. One is pregnancy. And we have to keep in mind with GLP-1s that these are analogs or copies of naturally occurring peptides or hormones that our body already produces. So that strict contraindication in pregnancy is done primarily due to the fact that GLP-1 studies have not been completed in pregnant women. In animal studies, there has been some indication that it can affect a pregnancy, but those have never been in humans, obviously. And so one of the questions that I asked people is, are you pregnant and are you using birth control? Because one of the unexpected benefits to GLP-1 is a noted increase in fertility. And so people are actually more likely to get pregnant on GLP-1s. And I've worked with people who say, I'm not worried about pregnancy because I haven't got pregnant in however many years sometimes. And what I say to people is, I don't care if you think you don't have a potential to get pregnant. If you have a uterus and ovaries, we're going to talk about birth control as part of your GLP-1 treatment. Well, first of all, the answer is yes, they're being overblown. There is good data out there. It's relatively new addressing this question directly. And the bottom line is, if you do anything to lose weight and you don't give your body the tools that it needs to build muscle and the stimulus to build muscle, you're going to lose muscle. The most work that our body does on a regular basis is moving itself around. And so if you weigh less, your body is doing less work, and it will oblige your request to do less work by getting rid of muscle mass that is unnecessary. So one of the things that I do with patients is set a protein target for them that they absolutely have to meet on a daily basis. You know, this question of muscle mass or Ozempic face or Ozempic butt or Ozempic finger, really quickly, interestingly, ring resizing since the onset of use of these drugs has about tripled.
Wow.
So Ozempic finger is a thing too. But the bottom line is that if you have enough protein and you give your body the stimulus to create muscle, meaning resistance exercise, you should not lose lean mass. And new evidence that is out within the last couple of weeks, I don't have it in front of me, but it does report that if a person eats protein and uses their body, muscle mass is not an issue. As far as Ozempic face, what that's talking about is loss of the fat in the buccal of your face, and then also losing skin turgor. Certainly will happen if you lose weight. It's like letting the air out of an overinflated balloon. You're going to have some loss of turgor in that balloon. But once again, eating a whole food diet and plenty of protein is going to minimize that.
Got it. So what are some other common misconceptions that you hear from your patients, your clients, when it comes to the GLP-1 treatment?
Well, you've hit on a couple great ones. One is that, muscle loss, which we talked about. A misconception that I have heard several times that comes off of social media is that I can eat anything I want with these medications and lose weight. That's not true. And when I see a person here in clinic and they're not succeeding, or they've succeeded and they've stopped succeeding, we don't talk about the medicine. We talk about their diet. So it is not true that you could eat anything you want on these medications and lose weight. That would be pure magic if that happened. It's not the case. Another misconception is this idea of gut paralysis, or that it has a significant impact to or risk for what's in the lay language gut paralysis, but really it's talking about gastroparesis or slowing of the GI tract. That can happen. And I have had a very few number of patients that seem to be immediately susceptible to it and who had to cease using the medications. But that is not common. It's very uncommon, and it is managed in nearly all cases by doing things to stimulate the gut or counteracting the direct impact of the GLP-1. And that's another reason that it's good to see a provider who's familiar with what actually is going to help that side effect. Recently, there's been a rash of information coming out about GLP-1 medications impact to vision or it causing eye changes. Just today, I was reading a meta-analysis from Medscape that said that that is not the case. And then, of course, the questions we ask about medullary thyroid cancer and pancreatitis has essentially been proven to be a misnomer. Those are not increased disproportionately when you correct for in population studies for predisposing factors, things like diabetes or family history. So, like I said, this is not a magic medication, but when you break it down, look at the side effects and look at the potential benefits, which are massive and fall well outside of weight loss on its own. The medication is extremely important. It's very safe and could potentially save tens of thousands, if not more, lives every year.
Wow, that's incredible. That's incredible to know. Now, I'm curious, Rick, when it comes to your approach to your patient care, to your client care, what role do you think creativity and artistry plays into that?
Well, especially with the aesthetic side, you've got to have an artistic eye. Us in this industry, we've all been taught, okay, give so many units of Botox here, give so many here, give so many here, 2 centimeters above the mid-pupil line, whatever. But you have to really look at the patient, see how they move, kind of understand the underlying structures, and then do what's going to be most effective for them. And that requires creativity and artistry. If Botox or fillers could be given based upon what's written in a book, they would be given by a machine, perhaps, or you put some sort of template on a face and you put filler in those places. So artistry and creativity is very important. Creativity also comes into play when you're working with patients on the GLP-1 side, because not everybody's the same and they don't respond to the same language or motivators or education. And sometimes you have to use creative means or use illustrations or teaching methods to have a person really kind of understand what's going on and why they're succeeding and why they're not succeeding. So I think as far as you mentioned the artistry and the creativity, it absolutely is necessary in the aesthetic side. I don't think you can do a good job without it. You have to be able to look at a person and have the experience and say, this is how it's going to work in this person. This is their potential outcome, and be able to also correct what unfortunately has been created by the available filters that you have on your phone. A person will take a filter, inflate their lips, get rid of their wrinkles, and bring in the picture and say, I want to look like that. Yeah. Well, we would all want to look like that, maybe, but you have to have good understanding of, we cannot arrive at that place from here unless we use filters. And so understanding the underlying capacity of the tools that we have right now is really important.
Okay. Now, Rick, I'm sure that you've had some very memorable cases throughout the years that you've been in this industry. Is there maybe one story that you wouldn't mind sharing, maybe a really tough case or a very memorable case, and how you were able to get them a successful outcome in the end?
Well, I'll start with the aesthetic side. I saw and continue to see a woman who came in, and she had a very interesting case in that when she was a child, she fell on the playground, got an injury to her skull and face, and it caused some circulatory changes that essentially left her with a face that became pretty significantly asymmetrical. So one side of her face almost quit growing and the other side continued. And her nose had became asymmetrical, her jawline was shorter, her cheekbone was not symmetrical with the other side. Even her eye had a different shape to it. So that was an interesting case because most of the time we're going for symmetry when we're doing aesthetic work. But with her, we started with asymmetry that was going to be always made worse due to the injury that she had. So I kind of had to look at her face and divide it in halves and say, okay, what do we want to do to raise the brow, to accentuate the cheekbone on the other side or on one side? How do we lower the jawline? Is there anything we can do to correct the nose? And the outcome was fantastic. And the reason that case is so memorable is that she came in and really had become, I guess, kind of almost embarrassed in her look. She didn't try to look nice or professional, or, there was not a lot of pride in her look. At the end, she still had asymmetry, but I continue to see her now, and her self-confidence, her ability to feel like she was attractive has massively changed. And it has made a major change in what she wanted to do as a career. She joined a different career track, and now she's a mid-level manager at an insurance company. And I don't take full credit for that, but I do think that her ability to feel confidence in her appearance made a significant impact. From a weight loss side, there's many, many stories. I've heard my life has changed many times, but one case that kind of sticks out comes from my alcohol use disorder study. And I was working with a woman who had an alcohol use disorder issue. She also had weight loss challenges. But she came in and she said, I have to tell you what has happened. She goes, for years and years, I've been struggling with alcohol. And there are some days that I won the war, and there are some days that I lost the war. She goes, but things are different now because I'm not winning or losing. It's like the war has ended. There's no fighting. And that's what we get with people, whether it's their motivation or drive to eat, especially carbohydrates, or overeat, or specifically with alcohol. We get people just almost look relieved that they're not fighting anymore, that these medications are giving them a tool that allows them to move beyond that years-long fight that many people have had and onto worrying about other things, worrying about being healthy in other ways instead of constantly counting calories and being told no, and being told by a doctor, exercise more, eat less and you'll lose weight. It's not that simple. And so to be able to use a tool that really allows a person to relax and focus on being well instead of trying to avoid being sick is really a nice experience.
Yeah, and I think the thing I love about both your stories there, it's the overall theme is that the ones that are really memorable are the ones where people just want to get their self-confidence back. They just want to feel normal or their best selves. It's not about trying to maximize, like, I want to look like a supermodel. It's never that. Like when I ask people what's the most memorable story, it's always about people who are struggling and they just want to feel good in their own skin, which I think is really people should think about in the aesthetics industry. It's really about getting your confidence back, not trying to maximize your aesthetic look.
Right.
So now, Rick, I want to dive into your practice, functional wellness and aesthetics. What's your vision for your practice?
I enjoy doing the aesthetic work. The aesthetics is something that's rewarding, but I also remember, and everybody who gets aesthetic work, whether it's Botox or fillers or whatever, we're really pushing back the clock. We're turning back the clock. And so what I enjoy doing is pushing back the clock, but also helping people to understand, okay, this is how we can push it back and slow it down so that you don't have to see me every 6 months. And we can do that through the use of classic aesthetic treatments, but also digging deeper. One of the things that I'm exploring on my own and from a practice standpoint is this kind of booming world of use of peptides for not only aesthetics, but for aging medicine and vitality. There is a hormone, or a peptide called sermorelin, for example, that is a well-studied and approved treatment that increases human growth hormones levels in people in a safe way. And I am using it myself. I'm getting great benefits. And once again, the side effect profile is almost zero. And many people report great benefits from it. Part of the challenge in working in this peptide world is there is a lot of snake oil, and there are ones out there that are not approved, and we don't use those. I will be happy, though, when some of those get studied and approved, because I think that we are, especially with maybe some of the research potential of AI, getting to a point to where we may be able to significantly decrease that aging impact, that impact of the 70% of our aging, our vitality that is impacted by what we do. And the nice thing about using peptides is that they universally work on our body's own systems. They are like sending a message to ourselves to turn this dial and turn this other one down. So they're generally safe as long as you're getting them from a safe source, and very, very effective. And so I think the future where I'd like to go with my practice is not only focusing on what we can do in the 20 and 30-year-old people to improve their aesthetics, but what can we do as a person enters their 40s and 50s and 60s and beyond to maintain their vitality. Of course, I'm 55, so I have some vested interest in that. But I really think that that's where I'd like to be spending more and more time, is helping people to maintain and maximize the degree of vitality and health that they've got.
Well, it's a great vision for your practice. Now, Rick, I do have one last question for you, but before I ask it, I do want to point people to your website at functionalwellsalem.com.
It's www.functionwellsalem.com.
Oh, sorry, functionwellsalem.com. My apologies.
No problem.
Okay. Now, the last question is, what does beauty mean to you?
What does beauty mean to me? It's a great question, because I have met some people who you would look at and you think, wow, that is a beautiful human. And then you get to know them and their beauty falls away. I've also met some people where you would not say they're beautiful, and you look at them and get to know them and their beauty becomes apparent after you get to know who they are as a person. And so what beauty means to me is really, from a very surface level, I think looking at a person and saying, that is an attractive person. What makes them attractive? They appear healthy. They appear kind. They appear to be a nice person in how they interact with each other, or how they interact, their relationship with others and the world. And then are they putting effort forward to maintain that beauty, whether it's how they interact with others or how they're caring for themselves. And so, I think it's pretty easy to say, look at a picture and say, wow, that is a beautiful person, or that's an attractive person. But I think many times that falls away. And so it's more than just somebody's outward appearance. It's who they are, and what makes them tick, that I think makes a person beautiful.
Well, there you have it. Rick sharing his expertise. Rick, where can people contact you and your practice?
So you're welcome to look at the website, which is found at www.functionwellsalem.com. And you're also welcome to give me a call directly at 503-991-8549. And I'd be happy to answer any questions for you. If you have questions regarding GLPs or aesthetic treatments, consultations are free, and I'd be more than happy to sit down and talk to you. And reach out if you have any questions.
Awesome. Well, Rick, this is awesome. Thank you for coming on. Thank you for sharing your message, and thank you for sharing your knowledge.
Thank you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.